And healthcare professionals need to listen to that intuition, as patients do too. They listen to the intuition, their own intuition, what is best for them. And the reason I'm talking about this...
And well, obviously you do listen to it, but let's say they're heading on a course that just seems to be detrimental to them.
Right.
How do you deal with that?
Find ways of them understanding that there are other things they can do. They can stay on a course doing things that make them feel good if they're on complementary approaches, but helping them understand that they need to add certain medical treatments as well. And some people are on the same medical treatment and they're going the wrong way. So it's working with them and that's where it's important, spending time with them.
Right.
And working as a team. So what do? I trust first in the patients and the family members, but it's huge, the trust in all of the team.
Right.
In all the nurses, the doctors that work with us, the physician assistant, the medical assistants. We're all working and helping the patients, and our intention will help them realize that they need to shift a little bit what they're doing if they're on a detrimental journey.
Well, let me ask another question, because I'm just thinking, what would you suggest an individual who has been diagnosed with cancer, how should they approach the physician, or do you think that's a separate discussion?
That's something we should talk about.
So let's do that next week.
Yes. But if we have, let's just give a number, 100 people with the same cancer, the same sex, age, stage of cancer. Everything looks the same on paper.
Right.
We grab a chart, we have 100 patients.
That match.
So in general, we'll say, well, they fit into these guidelines. The National Comprehensive Cancer Network guidelines, or any of the medical scientific guidelines, they're all this is the stage, this is the way they're treated. This is the surgical approach, radiation approach, chemotherapy, hormonal therapy, immunotherapy approach, period. We can't see it that way. We need to customize the treatment for each one of them. We follow those guidelines, but then for each person there's going to be a variation. And that's what's so important as doctors. We need to be flexible,
Right.
to understand that every person needs to be treated differently.
Mm-hmm.
The medical recommendations we give, the complementary approaches that they could do, it's going to be different, and that's mostly up to them to experience all these different complementary disciplines. But also the words we use, the way we say things is different for every person. If we talk to someone who has a hard time even conceiving the word cancer, if they're given statistics on how bad things could be, that can have them just give up.
Right.
And we know when people give up, we know the outcome. There are others who don't mind hearing how bad the cancer could be and what the statistics are. So we need to individualize the way we talk to each person.
Right.
And that's, again, a topic on itself. How do we communicate with patients depending on their emotional needs and in their beliefs, and how they're going to take the diagnosis of cancer.
Yeah, beliefs are so important.
They're huge.
And so you have to match their beliefs and create that synergy between you and them.
Because ultimately, it's what will help their quality of life and what will give inner peace.
Right.
And that's actually why we're doing this.
Right.
We're doing this so people can hear all these different possibilities and have inner peace, knowing that whatever they're doing or feeling or experiencing or thinking about, all these things are totally normal, and we all go through them.
That's a key. Thanks so much.
Thank you. Thank you.